I'm Dr. Les Lynette, and I hope to help you understand psychiatric problems. How to understand attention deficit hyperactivity disorder as the search for stimulation.
He's a wonderful boy and a joy and a boo. Gee, you should have seen him this afternoon. Bang went the brick slap, down went the table, crash went the china tray. But he said I couldn't help it, my walking heart ran away. Rip, rip went the curtain, wham went the window, crunch went the new buffet. And I heard him tell his daddy, my walking heart ran away.
Today, we're going to discuss a widely known condition, but one I believe is not well understood by many people and therefore neglected. That condition is attention deficit hyperactivity disorder, or ADHD, sometimes referred to simply as ADD. Why do I believe so strongly that ADHD needs to be better understood? It comes down to a simple fact. It's hard to solve a problem if you don't know what it is. If you mistakenly think of a problem as something else, you're likely to make mistakes in how you handle it. Often you will make the problem worse because you don't really know what it is. First of all, I want to emphasize what ADHD is not. Despite the name, attention deficit, it is not simply a condition in which you can't pay attention. Plenty of people with ADHD can pay attention to certain kinds of things. Also, ADHD is not simply a condition in which you are hyperactive. Plenty of people with ADHD are not hyperactive. Also, ADHD is not simply a childhood condition. Adults can have it too. So what is ADHD? I had recently completed an evaluation of 11-year-old Timmy, not his real name. His parents had brought him to me because of behavior problems and the teacher's complaint that he was underachieving in school. After evaluating Timmy, I explained to his parents that Timmy has attention deficit hyperactivity disorder, often referred to as ADHD. As a practice, after I inform families of my diagnosis, I welcome their questions and comments. One frequent remark parents make is, "I don't understand how he has attention deficit disorder. He can pay attention when he wants to." Timmy's parents then gave me examples such as his being able to sit for hours playing computer games, or that he can watch television for extended periods. But, they said, he just won't sit and do his homework. From his parents' point of view, Timmy doesn't seem to have a disorder. They see in Timmy a child who just doesn't seem to try hard enough or to care. I particularly like parents' questions because they give me an opportunity to educate them as to what ADHD is. Lots of people don't really understand the disorder. But the better they do understand, the more likely they will be able to make appropriate decisions on how to handle a child like Timmy. But if it's called attention deficit hyperactivity disorder, why can Timmy play quietly on computer games or watch TV? Isn't he paying attention to those activities? One of the problems understanding the disorder is the limitation of its name. Attention deficit hyperactivity disorder. It's a pretty good name, better than some earlier names we used, such as minimal brain dysfunction and hyperkinetic syndrome. Attention deficit hyperactivity disorder is a better name because it reaches closer to the difficulty in sustaining attention to tasks rather than simply the hyperactivity. However, if I were in charge of renaming ADHD, and I'm not, I would call it the Search for Stimulation Disorder, or SSD. Now, why do I use that name? The term attention deficit hyperactivity disorder sounds like Timmy has two problems. One, an inability to pay attention, and two, hyperactivity. Hyperactivity is just one symptom. And as with any disorder, people don't necessarily have all the symptoms. Timmy, in this example, is not hyperactive. Secondly, and regarding inattentiveness, Timmy's parents do not see him as having difficulty with attention. He seems to them simply to have an attitude problem. He seemed not to care. If only he had a better attitude, they thought. He would do his work and he would not get into trouble. They were certain he could pay attention if he wanted to. Now let's look at the problem of Timmy's inattention. He's actually having difficulty sticking to tasks such as homework or other relatively less interesting chores such as cleaning up his room. But it seemed to Timmy's parents that he just didn't want to do these things, not that he couldn't do them. Well, his parents are right partially. Timmy can do things that he's interested in, but he has trouble with tasks that require more sustained effort. It's not because he doesn't care. No kid wants to come home with bad grades. It's because he needs something he finds interesting in order for it to hold his attention. Timmy searches for stimulation. That often gets him into trouble because he doesn't pay attention when he's supposed to. He turns to look out of the classroom window when he should be listening to the teacher. He gets up out of his seat during the middle of a lesson. He annoys other children when they are trying to listen or do their work. Although medical science does not know exactly what causes ADHD, I'm going to explain what I think it is, just as I explained it to Timmy's parents. Most child psychiatrists, including myself, do not believe the root cause of ADHD is psychological. We believe an abnormality in the physical nervous system produces the disorder. The following is the explanation I gave Timmy's parents. I told them it is only an hypothesis and that no one really knows what causes ADHD. But the hypothesis has considerable explanatory value, and I believe something like it does operate in ADHD. I'm going to refer to the invisible shield. What do I mean? I would describe the abnormality in ADHD as a kind of barrier wrapping around the nervous system, an invisible shield that prevents normal levels of stimulation from getting through. It's as though Timmy has a layer around his nervous system and normal levels of stimulation don't penetrate it. Just as nature hates a vacuum, so too the nervous system hates sensory deprivation. Timmy needs stimulation, and if he doesn't get it, he'll seek it. This would explain Timmy's seemingly excessive need for excitement. Perhaps better put, he has a thirst for any stimulating activity. He responds to stimulation. He looks out the classroom window, not because he's lazy or wants to annoy his teacher and his parents, but because he's looking for something to hold his interest. He simply finds schoolwork and chores boring. He wants to do well. He would like to make his parents proud. But Timmy just can't seem to do it because he has an excessive need for stimulation. Timmy fidgets and is easily distracted. He can't maintain focused attention on what the teacher says. However, if she increases the level of stimulation, it gets through and Timmy can more easily pay attention. The teacher can get his attention in a variety of ways. She can teach in a more dramatic or dynamic manner. She can sit him in the front row and engage him more frequently with eye contact or questions she directs at him. She can even yell at him. Yelling will get his attention, but I don't recommend that one. Can the concept of the search for stimulation explain the effectiveness of stimulant medication? Well, the fact that stimulants such as Ritalin, Dexedrine, Adderall, Concerta, Vyvanse, and other stimulants can help people with ADHD is itself both interesting and instructive. Stimulants are the most effective medications for ADHD. Intuitively, we might think that if we were going to use a medication to help a hyperactive child, we would want to use a tranquilizer, not a stimulant. We might expect a stimulant to make the condition worse, since the child may already be hyper. The clinical fact, however, is that tranquilizers make kids and adults with ADHD more hyper, and stimulants make them better. How can we explain this curiosity? The idea of an invisible barrier around the nervous system might explain the curious finding that stimulants are the most effective treatment. We might think of a tranquilizer as tranquilizing Timmy and thus thickening that barrier, allowing even less stimulation to get through. Then Timmy feels an even greater craving for stimulation. He might thus become more hyperactive or more distractible, searching for stimulation again. Perhaps stimulants work in ADHD because they don't tranquilize. Instead, they stimulate the nervous system, perhaps leaving Timmy less thirsty, less hungry for outside stimulation, and better able to quietly focus his attention. How do we make the diagnosis? Not all children or adults with inattention have ADHD. For example, low IQ can produce inattention. Inattention may also occur when kids with high intelligence are placed in academically understimulating environments. Some oppositional children resist tasks that require self-application simply because of an unwillingness to conform to others' demands. There are certain medications, for example, bronchodilators, can cause inattention, hyperactivity, or impulsivity. So how do we make the diagnosis? I explained to Timmy's parents that ADHD represents a specific disorder. We should not recklessly label people with a diagnosis. ADHD has a shape, color, and feel. The diagnosis is made when someone has enough symptoms, at least 6 in a category of 9 symptoms, and there are 2 categories. One is the category of inattentive type symptoms, and to make the diagnosis, one would need to have at least 6 of these or 6 of the next group, which I will go into. The inattentive type symptoms include failing to give close attention to details or making careless mistakes, difficulty sustaining attention in tasks or play activities, not seeming to listen when spoken to directly, not following through on instructions and failing to finish tasks, difficulty organizing tasks and activities, reluctance to engage in tasks that require sustained mental effort, losing things, being easily distracted by extraneous stimuli, being forgetful. Now the other group, again, this group is called the hyperactive impulsive type symptom group, and to make the diagnosis, one would have to have at least 6 of the 9 symptoms in this group. It can be in this 6 of the 9 in this group or 6 of the 9 in the previous group. And this hyperactive impulsive type symptom group includes fidgeting, being unable to remain seated in the classroom or in other situations in which remaining seated is expected, running or climbing excessively, difficulty playing or engaging in leisure activities quietly, being on the go as if driven by a motor, talking excessively, blurting out answers before questions have been completed, difficulty waiting one's turn, interrupting or intruding on others. Many individuals with ADHD have at least 6 symptoms of inattention and at least 6 symptoms of hyperactivity and impulsivity. We give them the diagnosis of ADHD combined type when it's one group and not necessarily the other. We call it ADHD inattentive type when that's the appropriate group, or ADHD hyperactive type. And again, one can have the combined type. I'm sometimes asked what the role of brain scans, EEGs, and psychological tests are. Timmy's parents asked me about a test for ADHD. I told them we make the diagnosis on the basis of history and clinical observation. Psychological testing and neurologic examinations provide no significant value in establishing the diagnosis of ADHD. They in fact contribute little but additional cost to the process. Neurologic evaluation may, however, be used to rule out other neurologic disorders. Though the frequency of neurologic soft signs, which are mild neurologic abnormalities, is greater among children with ADHD, their presence does not confirm or refute the diagnosis, since subtle neuropsychological abnormalities are also found in a fraction of normal children. Psychological testing has not been shown to be diagnostically helpful. It can, however, be useful for detecting the possible coexistence of learning disabilities. Now, we've talked about treatment with stimulants, and I know, as many people do, that there are non-stimulant medications for ADHD also. But many parents are reluctant to put their child on medication. So let's talk about the risks of not treating ADHD. The condition prevents kids like Timmy from being able to focus and typically causes significant academic underachievement. Many people do not appreciate how serious a disorder ADHD can be. With adults, while academic performance may not be the issue, performance on the job and in relationships also suffers, because ADHD is a condition that operates 24 hours, 7 days a week. Perhaps not when you're sleeping, but basically all the time. Frequent complications are academic or job underachievement and poor self-esteem. Furthermore, the impulsivity, short attention span, and overactivity often make the child's behavior unacceptable to peers, and this also applies to adults, resulting in poor socialization and rejection by others because others often find it difficult to be around someone with ADHD. Antisocial and other behavior problems are an increased risk in those with untreated ADHD. ADHD also carries an increased risk of drug and alcohol abuse, partly because of the increased impulsivity of ADHD and partly because the individual is simply not happy. So what are the benefits of medication? 50 to 70% of ADHD children and adults respond with significant clinical benefit to treatment with stimulants. The nature of this improvement can be profound and is often not appreciated by those unfamiliar with the treatment responsiveness of ADHD. These medications often result in functioning at a level better than any the patient has ever experienced before. Children and adults with ADHD are not drugged into compliant behavior. Numerous studies report that stimulants can improve all of the core symptoms of ADHD, the hyperactivity, the inattention, the impulsivity, and treated with stimulants, Children and adults with the disorder are alert and responsive and have at their disposal greater options for skilled adaptive behavior and greater flexibility for behavioral choices. Left untreated, they are distracted, impulsive, disorganized, too easily overwhelmed by stress, and often hot-tempered. Now, we will talk now about non-medication treatment. Behavior management can be extremely important. It is essential to understand, however, that medication is the only intervention that will actually change the individual. Without medication, essentially only the environment, not the individual, is changed. Behavior management means changing the environment so that the inattentive and impulsive individual can function better in what would essentially be a more stimulating environment. I'm asked sometimes about parent training for behavioral management of ADHD. Sometimes it's quite helpful, and it can be taught to parents in order to enable them to more effectively manage the child's day-to-day behavior. Altogether, however, it should be remembered that behavioral management is a way of helping the parents to cope with, but not to change, the underlying behavioral dysfunction caused by ADHD. Behavior management techniques will involve a decreased emphasis on blaming the individual and increased emphasis on changing the child's or the adult's environment in order that the individual function better. Only medication can change the central symptoms of the disorder. So what are some general principles of behavior management? First, ADHD is a biologic deficit in the persistence of effort, attention, and inhibition. ADHD individuals typically also exhibit a reduced sensitivity to negative behavioral consequences and to positive behavioral consequences. These characteristics are not the result of laziness or moral weakness. So, non-medication techniques include the following. Use immediate consequences. Occasional praise a few times a day works for normal children and adolescents, but ADHD individuals require very frequent feedback. They are much less influenced by general rules than by immediate consequences. Positive consequences or positive feedback may take the form of praise or material rewards, but it should be clear, specific, and occur as close to the moment of the desired behavior as possible. Don't wait until the end of the week or the month to reward. Give frequent feedback. The adult who's doing the training may find this tiring, but frequency is necessary in order to change the patterns of behavior that have developed in the ADHD individual over time. Adults who are doing the training need to remember to observe for behavior for which to give feedback. Employ powerful consequences. For the ADHD individual, verbal praise is rarely sufficiently potent by itself. The addition of physical affection, privileges, and material rewards increases the effectiveness of positive feedback. Sometimes I'm asked, aren't we bribing the child with such frequent rewards? My answer is that rewarding is not the same as bribing or spoiling. Bribery, or spoiling, is giving some reward to someone for doing something he or she shouldn't have been doing in the first place. Rewarding, in the sense that I mean it, is giving an incentive for desired behavior. Start with rewards before punishments. First, redefine the problem into a desirable alternative rather than simply saying, don't do this or that. Then reward it consistently for a week or two before beginning any punishment for undesirable behavior. Punishment, if necessary, should be mild and very selective, only for specifically designated negative behavior, not for everything that is offensive. The ratio should be 3 rewards, positive, for every punishment, negative. Now, I've talked about how hard it is to parent or to live with someone with ADHD. The divorce rate is higher in people with ADHD. They also have more accidents and wind up more frequently in the emergency room. So if you are a parent or a partner or a friend of someone with ADHD, maintain perspective. Remember, you are dealing with a handicapped individual. Forgive your child or the adult with ADHD when inevitable failures occur, but also forgive yourself when you lose your cool, which you will. But don't give up. People with ADHD can be very worthwhile people who function quite well when properly diagnosed and treated. Thank you. So hit that button in the upper right-hand corner of your screen to subscribe. You'll see my child psychiatry channel on the subscription section of your YouTube homepage. And when I produce a new video, it'll show up there. But don't go away. By previewing my additional channels, you can subscribe to a different one of your choice. Subscribe to Adult Psychiatry by hitting the subscribe button. Hit the subscribe button for videos on child psychiatry. Subscribe to Attention Deficit Hyperactivity Disorder. Subscribe to Parental Alienation Syndrome. Click the button on the lower left of the screen to subscribe to all of my psychiatric videos. You will then be able to select from the entire library of psychiatric videos. But if you prefer, you can narrow down to one or more specific channels of which you are about to have an opportunity to preview. Subscribe to Adult Psychiatry by hitting the subscribe button. Hit the subscribe button for videos on child psychiatry. Subscribe to Attention Deficit Hyperactivity Disorder. Subscribe to Parental Alienation Syndrome.